Hello. So this is Northern Lights Acadia Hospital. Northern Light Acadia Hospital is a psychiatric hospital that serves the entire state of Maine. We provide inpatient and outpatient behavioral care for children, teens, and adults, while specializing in treatment of mental illness and substance abuse. Our website is full of resources and helpful information, but if you can't find what you're looking for, please give us a call. So here's their address and phone number. Northern Light Acadia Hospital is more than a hospital. We are a hub for behavioral and mental health services and expertise throughout Maine. Our mission to empower people to improve their lives. Our vision to be the psychiatric provider of choice. Our values compassion, accountability, integrity, and respect. The care we provide to our patients is rooted in compassion and respect. A 100-bed acute care short-stay psychiatric hospital, we provide a full continuum of mental health and behavioral health services for children, teens, and adults. Our interdisciplinary care team work closely together to wrap our patients with the comprehensive care they deserve. We meet patients where they are, whether in our offices or virtually, from the comfort of their home through telehealth. Acadia makes patient access easy. Acadia's hospital's services reach deep into our communities through many specialized programs, including our behavioral health home, opioid health home, military veteran programming. Let's see here. Integrated behavioral health in primary care practices, and school-based clinician services. Beyond these programs, we're strong advocates for the advancement of behavioral and mental health through our partners with Yellow Tulip Project, our award-winning Acadia Cares program, LGBTQ+ advocacy, and much more. Acadia Hospital is a member of Northern Light Health, an integrated health delivery system in Maine with 10 hospitals, home care and hospice, emergency transport network, population health company, and retail pharmacy. Okay, so adult, individual, and group therapy. Northern Light Acadia offers expert, cohesive outpatient therapy options for adults and seniors with a variety of diagnoses, including depression, anxiety, bipolar disorder, schizophrenia, ADHD, substance use disorder, neuropsychiatric conditions, and more. Individual therapy, now offered virtually. Individual therapy allows you to work on problematic behaviors, beliefs, feelings, and relationships, as well as somatic symptoms. The therapy department practices evidence-based treatments that include cognitive behavioral therapy, dialectical behavior-informed therapy, acceptance and commitment therapy, motivational interviewing, and EMDR. Treatment is tailored to the individual, focusing on strength and skill building. We strive to empower people towards self-determination. Group therapy, now offered virtually. Acadia Hospital offers a robust selection of couples, family, and group therapies. Groups have a rolling admission. Members of a group can start at any time. Groups are typically held once per week, and they can be billed to most insurances. So, intensive outpatient program, now offered virtually. Our intensive outpatient program is designed for adults needing intensive short-term treatment for mental health issues and/or substance abuse problems. IOP is an evidence-based group therapeutic program run by a diverse team of professionals who are prepared to offer you an array of treatment options and support services. Behavioral care. Northern Light Behavioral Health provides the services you need to ensure you're living your best life. We have a range of treatments for children, adolescents, and adults dealing with mental illness. We provide these in a setting that are relaxed, comfortable, and as discreet as you need, sometimes even in your own home. Electroconvulsive therapy. Northern Light Acadia Hospital is the only program in eastern and northern Maine to provide electroconvulsive therapy, and the only program in central Maine to offer ECT as a part of a full continuum of care. Our service is easy to access and provides a friendly and comfortable environment for the patient and his or her family members. We also provide family education, which enhances the patient's recovery. Okay, eating disorder treatment program. Acadia Hospital offers outpatient treatment geared specifically to help people of all ages struggling with eating disorders or eating issues that affect their daily lives. We are pleased to share that our program is now offered 100% virtually, reaching patients throughout Maine. Our experienced medical and clinical team work closely with patients, their families, primary care teams, and others to provide care focused on the individual needs of the patient. Participants need to be medically stable as a requirement for participation in our outpatient services. This may require weekly medical monitoring with an established primary care physician. Medical monitoring is not a service provided on site. Our program is not a lieu of higher level of care treatments. Treatment options include individual, family, and group therapies, or a combination of these options. Healthy Life Resources is a comprehensive, coordinated, and actionable set of support for employers to promote a strong and functional workforce. Our goals are to improve employee wellness and resiliency by enhancing their abilities to cope with uncertainty and to adapt to change and a new normal in the workplace, preventing burnout and improve employee retention and engagement, reducing compassion fatigue, secondary traumatic stress, and workplace stress to improve overall mental wellness, productivity, and quality of patient care. Maintain strong levels of employee satisfaction, trust, and loyalty to the organization and our patients. Enhance the customer experience through a more engaged, confident, and cared for workforce. So how you can access this is to contact Angela, and there's the number and stuff about that program. Mood and memory care. Although most of us expect to be healthy and independent in old age, chronic disease begins to take their toll on resiliency, morale, and daily function. Problems with mood and memory are common. By age 80, more than 20% of seniors will have significant problems with depression, dementia, or both. Many others will struggle with anxiety, sleep disorders, and drug and alcohol dependence. We offer specialized care to address the needs of seniors through our expert diagnostic assessment and treatment in coordination with primary health care and community services. Our goal is always to reduce suffering and improve independent functioning in those with conditions such as depression or dementia. To achieve this, we address that many mental, physical, and social issues associated with advanced age that can affect comfort and function. Our mood and memory care services consist of outpatient care in the hospital, nursing home consultation, research clinical trials, and education for families and healthcare providers. When necessary, we provide physical, speech, and occupational therapy in close coordination with primary care physicians and nurses. Our mood and memory care services relies on nurses, nurse practitioners, a psychologist, and geriatric psychiatrist to provide a comprehensive initial evaluation and make as accurate a diagnosis as possible. Our staff also coordinates with the patient's primary care physician and specialist to provide an effective and safe treatment. Our services are covered by Medicare, Maincare, and most private insurances. We offer access to a wide variety of behavioral and mental health services for children and teens in both the inpatient and outpatient settings, in schools and in the community. Northern Light Acadia Hospital offers quick access to a wide variety of mental health services for children and teens. Some of the services we offer include mental health evaluation, medication management, individual and family therapy, specialized outpatient group therapy, occupational therapy, care coordination, day treatment services, and inpatient treatment. We treat our patients at different levels of care based on the clinical appropriateness, the desire of the family, and the input from referring sources. We also understand the value and need to maintain a connection with the patient's other care team members, with the ultimate goal of returning the patient to their original providers. We make every effort to collaborate on a course of care with any providers and school district identified as the discharge resource. With guardian permission, we will share clinical information, including treatment changes and discharge plans. We take referrals 24 hours per day, 7 days a week. All referrals get immediate attention for access to the appropriate program for screening and intake. Call our Behavioral Health Resource Center at 207-973-6048 or 1-800-640-1211. Psychiatric medication. So I get a little runny nose today. Psychiatric medication management can be a great helper in improving your mental health and wellness. Our psychiatric nurse practitioners are supervised by a local psychiatrist to ensure you receive the best care. Symptoms improvement is tracked at each session, allowing timely adjustments and better results. They teach the latest research and use evidence-based medicine to tailor treatments to your unique needs. Our psychiatric nurse practitioners collaborate with you and your primary care doctor to identify the best treatment options available. Many people struggle through mental health disorders, live fulfilling lives with the help of psychiatric medications. While medications can't cure mental health disorders, they do treat symptoms that might otherwise be debilitating, making you feel better so you can function better. Research studies show that CBT and psychiatric medications often produce better results together than either one alone. We offer both services under the same roof to ensure the best care and convenience for you. Substance use disorder treatment. Call us today at 207-973-6100 to begin your path to recovery. Our substance use disorder treatment program is now accepting new patients. Patients can be seen quickly, often within a few days. Acadia accepts most insurances. But if you do not have insurance, our staff will work with you to find coverage and apply for financial assistance. Substance use disorder, sometimes referred to as addiction, is a disease and it needs treatment, not judgment. The disease is characterized as being a mild, moderate, or severe dependence on drugs, alcohol, or prescription medication. Many people living with substance use disorders go on to live healthy, fulfilling lives with the help of medication-assisted treatment, counseling, medication management, and/or behavioral therapies. We believe in an atmosphere of mutual respect and trust. You will receive compassionate, individualized care at Acadia Hospital, provided by a highly skilled and knowledgeable staff of physicians, nurses, and mental health and substance use counselors. Evidence shows that many people living with addiction also have an underlying mental illness. Our providers can diagnose mental health issues you may be experiencing to give you the best chance for recovery.